Hello everyone, today we are going to learn the vocal resonance and my name is Gao Yuan. For this part we will learn the 4 sections. It's bronchophony, pectoralochi, egophony and whispered. So for the vocal resonance we need to learn, this is our respiratory systems. We have mouth, pharynx, larynx, and trachea. So when we speak, the sound go down to the air, to the trachea, bronchial, to the lungs. So the vocal resonance is produced in the same fashion as vocal parameters. It is elicited by having the patient repeatedly say E with ordinary voice loudness. So the sound vibration at larynx will conduct through trachea, broncho, alveoli, and chest wall to the stethoscope. So normally the words spoken are not as loud and clear as when we hear directly, and the syllables are not distinguishable. So it is heard loudest near the trachea and the major bronchi, and is less intense at the lung basis. So the voice transmission, it will decrease when a quantitative decrease in the voice transmission could be due to any other form of lung or pleural disease, like if they have pneumothorax, the voice cannot conduct well. If they have pleural effusions, they maybe have a higher. So the qualitative alteration of the voice transmission is noted over consolidation or along the upper margin of pleural effusion, like egophony. So this is very special. The sound is like a nasal tongue or goat bleating. It is called egophony. So we will learn the 4 different vocal resonance. The first one is bronchophony. Vocal resonance that is increased both in intensity or clarity. It is usually associated with increased vocal parameters, downest to the percussion and abnormal bronchial breathing. So it indicates the presence of pulmonary consolidations. And the next one is pectoralochi. It's a kind of bronchophony that is more intense and clear and near to hear. The syllable may be understood when the patient whispers. So when the patient whispers, the syllable you can understood. Its presence always indicate a large area of consolidations, like if the patient have a large, like the whole lobe pneumonias, the sound can transmit more clearly to your stethoscope. You can hear what the syllable he says. And also, occasionally, pectoralogon may be obvious before bronchial breath sounds develop. So when you do this, like vocal resonance, if more clear you hear pectoralochi, it indicates maybe some pneumonias and some like disease. Egophony, so you need to, from this class, you should remember it's very special. Not only there is an increase in intensity of the spoken voice, but its character is also altered. So there is a nasal or bleating qualities. So when you ask the patient to say E, 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 but you hear if egophony is present, they will sound as ah, ah, ah. If the patient see E, you hear with your stethoscope on their chest, on their alveolar vascular position, you hear ah, 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 like a goat sound. It's called egophony. It is often heard over the upper portion of a moderately pleural effusion, or where there is a small amount of pleural fluid in association with pneumonic consolidations. So this is really special. You need to remember this one. The next one is whispered. The whispered pectoral loci, the sounds must actually whisper as e, e, e. In the normal subject, the whispered voice is heard only faintly in the area, while the bronchiovascular breath sounds are normal heard. Accentuated or higher pitched pectoral loci could be clearly heard when there is a pneumonic consolidation. Thus is a sign of value for diagnosis of pulmonary consolidation. So it's like the air transfer from the lungs. If there is consolidations, it can transfer more clearly to your ear. You can hear it more clearly. So this is all the resonant part. For today's class, we heard full vocal resonance. Pay attention to them, and if the patient have this sound when you do the vocal resonance, pay attention and do some CT scans to diagnose the disease. Thank you very much.